The decision for the type of breast cancer surgery is crucial for better survival rates and quality of life after treatment, and there is a great deal of information to sift through. This channel aims to help women diagnosed with breast cancer understand their choices and the technical details they may be presented with. In this video, I will present a brief overview of the different types of oncoplastic breast surgery. After discussing a few techniques described by other surgeons, at the end of this video, I will share illustrations of cosmetic outcomes after I performed restorative breast cancer surgery. So please watch the video and stay until the end to appreciate the many different techniques that have been proposed by multiple teams of breast surgeons. Our discussion will include what oncoplastic breast surgery is, a few examples of how oncoplastic surgery is done, its related results, and how this might compare with those of restorative breast surgery, which is my preferred approach. Please note that the surgical techniques presented and information provided in this video are solely for educational purposes and are not intended to replace a medical consult. Do see your doctor to understand your unique circumstances for treatment planning. That said, allow me to first explain the concept of oncoplastic breast surgery. The premise for OBS is the fact that after breast-conserving cancer surgery, up to 30% of women have a residual deformity. Since 2002, when Professor Baldam wrote this article, until now, there have been a multitude of surgical procedures proposed to correct and/or prevent the possibility of deformity. Some surgeons have included reconstruction after mastectomy in its classification. But in this video, I will focus on the surgical techniques used to avoid distortion of the breast, which are performed at the same time as cancer removal during breast conservation. The main reason for distortion is the space or defect that is created in the breast tissue after complete removal of the cancer. This space must be repaired or restored in order to avoid deformity, and can be done through volume replacement or volume displacement techniques. Volume replacement is usually achieved through the use of flaps. Less commonly, implants may be used. More recently, there is research on the use of 3D printed materials, but this is yet to be widely accepted in clinical practice, and therefore will not be discussed here. Volume displacement procedures are often referred to as mammoplasty. In these cases, breast tissue is moved to fill the space, and it may be necessary to perform surgery on the other healthy breast to equalize both breast sizes. The distortion of the breast may appear like this. Many surgeons have proposed numerous techniques which can be applied during surgery for cancer removal to avoid such a deformity. Let us now discuss volume replacement techniques. Tissue volume can be replaced through many ways. Most commonly, this is done by using the patient's own tissue from another part of the body, also known as autologous tissue. Muscle or subcutaneous tissue, with its blood supply intact, may be moved to fill the void. This is medically referred to as a flap. Flaps may be harvested from tissue just outside the breast, known as local flaps, or they may be obtained from elsewhere. Alternatively, fat grafting or implants may also be used to replace tissue loss. While these are the more common means of volume replacement, please note that there are many other approaches which can be used. It may be helpful to ask your surgeon about the method which is most suitable. Here is an example of the final post-operative cosmetic result after the use of a local perforator flap. This incision was used to harvest an intercostal perforator artery flap to fill the space after removing the cancer below this scar. This team of surgeons from Nottingham recommend removing a muscle from the thigh called the gracilis to fill the space created by cancer removal in the upper inner quadrant of the breast. At the end of the procedure, the patient would have this scar in her breast and this scar in the thigh. As I always aim to minimize the number of scars and tissue movement when I operate, personally, I do not use this technique. Here is a method described using an implant to fill the space within the breast after removing cancerous tissue. There may be issues with this approach, and you may wish to watch this other video to have a better understanding of what recovery can be like after implant surgery. Because of these issues with the use of an implant, I do not use this when treating patients with breast conservation surgery. Having looked at some examples of volume replacement, we will now discuss volume displacement. Many of the volume displacement techniques were adapted from plastic surgery breast reduction methods and adopted as part of the volume correction process following cancer removal. The term oncoplastics is derived from the combination of onco, which is short for oncology, and plastics, referring to plastic surgery. When there is significant volume loss after cancer removal, there may be a need to equalize the breast size by performing a similar procedure on the uninvolved breast. This process is known as contralateral symmetrisation. Here is an example of a left mammoplasty performed for cancer, together with a similar procedure for the uninvolved right breast to equalize the breast size. As mentioned, the latter operation is medically termed contralateral symmetrisation. It is necessary in such cases to have preoperative planning with respect to incision placement and tissue removal so that appropriate volume of breast can be removed on both sides. While this is a technique commonly used by other surgeons, I personally do not apply it. This is another example of a technique which employs volume displacement. The cancer was in the center of the left breast below the NAC, which is the abbreviated form of nipple areolar complex. In this case, the cancer was removed with a clear margin, and a technique referred to as the lejeune or vertical mammoplasty was used to repair the defect created by cancer removal and reshape the breast. Once again, please note that these are only two of many techniques which can be applied to avoid deformity after breast cancer treatment. In 2025, this team of doctors summarized the techniques used for the correction of breast deformities after breast-conserving surgery in this table. They also listed the pros and cons for each technique. Please feel free to pause the video if you wish to study the items in detail. For further information on the articles discussed in this video, please fill in a comment or submit a personal request at the Just Medicine website, the link to which is provided in the description below. Each patient should discuss with her surgeon about suitable techniques. As mentioned earlier, I do not apply mammoplasty, flaps, or implants for my patients. I use techniques which I refer to as restorative breast cancer surgery, where I only use tissue that remains after cancer removal to repair the breast defect. You may have seen these results in my other videos already. These patients had cancers in different positions of the breast: upper outer quadrant, lower inner quadrant, upper inner quadrant, and in the central part of the breast. Should you wish to have a better understanding of their outcomes, please submit a request on the Just Medicine website, the link to which is listed below. Why do I perform restorative breast cancer surgery for my patients? It is because these techniques allow similar postoperative recovery as standard breast-conserving surgery, while minimizing deformity. There are no additional scars and surgery over other parts of the body, which means these techniques are expected to be associated with fewer postoperative complications and therefore a quicker return to usual activities. In this study, it was found that of women who underwent standard breast-conserving surgery, 1.74% had surgical complications. In my experience, women who undergo restorative breast surgery have very similar complication rates. Compare this with complication rates that were reported in this study. Here, the researchers found that the overall postoperative complication rate was 33.9% for oncoplastic reduction or mammoplasty procedures, and they acknowledged that this was higher than for breast-conserving surgery with radiotherapy. For women who underwent chest wall perforator flap reconstruction, which are volume replacement techniques involving local flaps, complications were seen in 16.7% of patients. I acknowledge that these three studies were separate and patient populations may be different, but these research data suggests that breast-conserving surgery without flaps or mammoplasty results in fewer postoperative complications. Next to treatment that offers the best survival, surgical complication rates is an important consideration when I advise patients on the type of therapy. Needless to say, the lower the complication rates, the better for patients. Thank you for staying until the end of this video. I hope this very brief presentation has provided some insight into the various methods of oncoplastic breast surgery and how the choice may differ from one patient to another. If you have found the content helpful, please like, share, enter a comment, and subscribe as a signal for more such videos. As you know, in this channel, there are many more videos which share information regarding breast cancer surgical treatment to empower women to make therapeutic decisions which help them live longer and live more. I hope you will join me in these other videos as well. Until we come together again, take care.